Hello, my name is Michael Cohen, and I'm the Director of Cardiopulmonary Program here at North Westchester Restorative Therapy and Nursing Center in Mohegan Lake, New York. The goal of our program is to help you achieve the most active and productive life possible despite any limitations from chronic and acute conditions such as COPD, emphysema, asthma, recovering from pneumonia, post-COVID, and other pulmonary conditions. I am here to oversee and guide you through our cardiopulmonary rehab experience in a safe, structured, monitored, individualized, and caring environment. I will assist you in coordinating your care with our expert multidiscipline team, including our pulmonologist, Dr. Arun Agarwal, and our two cardiologists, Dr. Glenn Hamroff and Dr. Ira Schwartz, who make in-house rounds twice a week, with one-to-one direct care from our expert rehab therapists, including physical therapists, occupational therapists, and respiratory care. We utilize state-of-the-art cardiopulmonary equipment and strength training to improve your strength, endurance, well-being, and confidence. You will be educated on proper breathing techniques to minimize feelings of shortness of breath or overexertion, on how to be more independent in making better daily choices. We will educate you on your cardiopulmonary disease and teach you coping strategies to reach your goals. Every cardiopulmonary patient receives a cardiopulmonary binder to keep you with information on cardiopulmonary conditions and strategies to help you manage and prevent any setbacks along the way. Each patient will receive a pulse oximeter to check your oxygen level and to be educated on its proper use. What does this all mean when we add it up? Back to your baseline and fewer readmits to the hospital. We know pulmonary disease can be very hard, but we are here to show you some options. It will be our privilege to assist you in your recovery. We look forward to working with you and your family member. Thank you.
Hi, my name is Rosie Zani. I'm the clinical advisor and educator for the cardiopulmonary program here at North Westchester Restorative Therapy and Nursing Center. Our patients come to us for exceptional care in order to return home swiftly and to prevent rehospitalization. We care for a variety of patients with lung issues, such as those recovering from illnesses like pneumonia, COVID-19, others suffering from an acute episode of chronic obstructive pulmonary disease, asthma, emphysema, and other chronic lung conditions. Some patients with sleep apnea requiring the assistance of a machine at night with a mask to support their breathing. We maximize their comfort so that they may reap the full benefit of the treatment. Patients receiving oxygen, we work closely with them so that we may assess if they can tolerate a lower amount or even be discharged on no oxygen at all if possible. A cardiologist and a pulmonologist are part of the interdisciplinary team involved in the evaluation and treatment of our patients. The nurse and the respiratory therapist also hold weekly medical rounds with the doctors to discuss patient progress and steps towards their discharge. We use the most innovative equipment to prevent patients from returning back to the hospital. Patients are also evaluated for swallowing, eating, and speaking to further enhance their quality of life. This ensures a more focused perspective regarding their care. Here at North Westchester Restorative Therapy and Nursing Center, you can breathe easy, knowing that our experienced staff will do their absolute best in caring for your loved ones.
Hi, I'm Lisa Penziner, a registered nurse and director of special projects. An important part of any program, especially a cardiopulmonary program, is the continued follow-through of the patient. Here at North Westchester Restorative Therapy and Nursing Center, we take it very seriously. Our goal is to maintain your best quality of life and to prevent rehospitalization. We have patient navigators who follow up after discharge with the patient 48 hours, 7 to 14 days, and a monthly check-in to make sure the patient has received the appropriate equipment at home, that they've made any important appointments with their physicians, and have gone to their follow-up appointments. In addition, each of our facilities work hand in hand with the American Lung Association, keeping updated on the latest information for patients with pulmonary issues, and hold Better Breathers Club meetings where our Director of Pulmonary Rehabilitation meet once a month with not only discharged patients, but anyone in the community who would benefit. Due to the current situation, we are having our meetings on Zoom. Hopefully, in the near future, these will be in-person meetings. The Better Breathers Clubs are designed to promote respiratory health and a better sense of well-being for those living with chronic lung disease. The meetings are free and new members are always welcome. These meetings help us keep track of our discharged patients and handle any issues or concerns that might come up. Please contact the Community Liaison, Phil Mimo, at 845-222-3473. Thank you.